A lot, says Lisa's surgeon, Dr. Edward Domanskis of Newport Beach, California.
There's no question that the amount of plastic surgery that we do on teenagers has increased.
I'm going to turn you over to Dr. Domanskis then, okay?
Hailey was concerned about the fact that she was small on both sides. There was some asymmetry, but fairly minimal. No question about it, it was a cosmetic enlargement. On the smaller side, we increased her from an A to a C, and on the other side, where she went from about a B to a C also. So they definitely wanted to enlarge both sides because they wanted a cosmetic improvement.
This is a serious procedure. Anesthesia is involved. People sometimes die in these procedures.
I agree. It is a very serious procedure. Looking good is still even better than feeling good to them.
So you tell them the risks and they just shrug it off.
In most cases.
Dr. Domanskis sees those shrugs coming from younger patients all the time. How young is the youngest patient that you've done this sort of surgery on?
In liposuction, the youngest probably has been around 14, actually.
14?
Yeah. Unfortunately, a teenage girl's life almost every day is like a walking Miss America contest.
It doesn't look like it's going to be possible.
Possible for 17-year-old Adrienne Bell to get a breast enlargement using saline implants. When the Food and Drug Administration made the announcement last month, Adrienne was devastated.
I don't think it's fair that, as long as you have parental consent, I think that's, legit enough to get something done. The government should be able to say you can't get it done at all.
Just so you know, I'd love to be able to do it, but, we basically have to follow, unfortunately, the rules.
And the FDA rules now say that a woman must be over 18 to have the surgery.
Patients should have a choice.
Newport Beach plastic surgeon Dr. Edward Domanskis says the government should not make that choice because the government doesn't always know what young women are faced with.
These are very psychologically traumatic experiences for girls to go through, especially in the high school period when they're faced with gym, when they're faced with really starting to have their bodies develop.
But the Food and Drug Administration has a different take. Its advisory committee has expressed major concern for women under 18 having these saline breast implants. The agency says its decisions are based on scientific data, and women under 18 are still developing physically and emotionally, and the saline implants are inappropriate.
Unfortunately, the media, the magazines, all their idols, so to speak, have either have large breasts or have had implants.
If you want to get it done to make yourself feel better, then I think you should.
David Nazar, OCN.